Please state your name and your year in pharmacy.
Okay. My name is Nabila Chowdhery Martinez, and I'm currently, well, today is actually my last day of my fourth year of pharmacy school.
And we could just dive into our first question. Please describe your activities regarding the COVID-19 and pharmacy.
My activities with COVID during my Block 8, I was actually in Puerto Rico in a non-traditional API rotation. So I was actually placed in a specialty pharmacy that specialized in providing services to nursing homes, assisted living communities, even correctional facilities. And as interns, we were just asked to perform, services like MTMs, MedRecs, and also contact medical providers if any type of interventions were needed. So around my last week, I was actually asked by a pharmacist to, look up some information with regards to use of Plaquenil and azithromycin in COVID-19 positive patients. So for this, I just kind of dove into looking at guidelines and finding really valuable resources, like trials that have been conducted in China, the rationale behind the use of these medications for COVID-19 patients, and also guidelines across the United States. And one that I found particularly interesting was the Michigan Medicine Guidelines for compassionate care for COVID-19 patients. So basically, summarized, provided all this information to the pharmacists, and guess it was valuable, especially with medications like hydroxychloroquine. We want to make sure we're giving patients the right dose for safety reasons. Of course, our main concern is this medication causing QT prolongation in patients, especially elderly with heart complications. So it was a pretty valuable rotation, a learning experience, basically. And it felt good to kind of contribute to that growing knowledge of treatment options for patients. And obviously every week it's changing rapidly. So yeah, it's definitely really, my past rotations with Michigan Medicine definitely helped me prepare for this, because I literally only had 2 hours to build up all this, summarize all this information in one for the pharmacist. It was my last day on rotation. And it was actually the same day the president announced this really useful drug in patients with COVID. So so definitely it was also a good basis for my next rotation, which was basically focused on COVID-19, everything to do with it, how the country's responding to it. So yeah, it was definitely a good learning experience. Yeah, so everything was pretty much like normal up until my very last week. They actually initiated a stay-at-home order with a mandatory curfew at 9 p.m. So basically, it even put some penalties, like if you are out after a certain time, or if you're not, out for any reason, like going to the grocery store, you'd be fined up to like $5,000, potentially like 6 months in jail. So me and the other student from University of Maryland, we both were given letters as proof of being essential workers. So we were still going to rotation as usual, still on site. And, we took all the precautions. And a very interesting thing, a cultural thing we have amongst friends here in Puerto Rico is greeting each other with a kiss on the cheek. So my friend and I transitioned to an elbow bump instead. Yeah, so a lot of things we had to change. Of course, like Puerto Rico's been through a hurricane from a couple years ago, most recently an earthquake. So they're pretty aware that thousands of patients being infected with COVID was the last thing they need. is very difficult for them to handle. So everyone was pretty much on board with these stay-at-home orders. There was no complaint, no protests. If they did protest, it would be actually in their cars, so they still maintain social distancing. And they seem pretty united in this whole, pandemic situation. And yeah, it was actually pretty good. There was a lot of solidarity there for sure. I accepted a job offer from Rite Aid Pharmacy, so definitely like I'm still working with them. So with regards to my roles here in Michigan, so currently pharmacists are allowed to order and even administer like COVID-19 tests. So Rite Aid Pharmacies actually started a drive-through for COVID screening. So definitely will be working with them to do that. And yeah, and just honestly just keep answering patient questions. There's a lot of misinformation out there. We've seen in the past patients have actually died from trying to self-treat with the wrong medications or chemicals. So definitely you know, just playing the role as a pharmacist and keeping track with clinical trials and just letting people know like accurate information, so things like that. I guess what I love most about Michigan is the extraordinary faculty we have here at the College of Pharmacy. They were very quick to respond to the pandemic. Most of us had our rotations canceled in hospitals, and they put together a rotation very last minute that actually prepared us really well as graduate pharmacists moving forward, especially with regards to handling the pandemic. So glad to have you as part of this year's Pharmacy Scholar Program. Best of luck to you in studying for your PCAT, and go blue.